Welcome back to the Ricky Matthews Show from the Citizens Bank studio. I enjoyed that conversation with Austin Golding. We're lucky to have access to Austin. He's a terrific young CEO here in Mississippi, running a really, really important business, and we can really understand what it's like to operate in the Mississippi Sound and on the Mississippi River, and what's happening in the global markets when we talk to Austin. So it was a great conversation. Listen, I am so thrilled now to shift gears. This is the second week in a row. This is the second installment of Singing River Health Talk. It's going to be a weekly feature on the second half of every single Wednesday show in partnership with Singing River Health System. And we're going to, we're going to get a weekly dose of health advice backed by the best. And today we're going to focus on weight loss and I think just healthy living in general. And I'm excited to have joining me today Madison Ainsworth, who is a registered dietitian and nutritionist. And we're going to talk to her about what she does and where she came from and all of that. But before we go any further, let me welcome Madison to the conversation. How you doing, Madison?
I'm doing great, Ricky. Thank you all so much for having me today. I'm really excited to be able to share everything that we do.
It's good to see you. Listen, first of all, where are you sitting right now?
Well, I am in our Pascagoula clinic office. We actually have several clinics along the Gulf Coast for people who don't know. And we're not just weight loss surgical services. We offer general surgical services as well. But we have our location here in Pascagoula. And then, of course, as far as our weight loss clinic is concerned, kind of our main hub is in Ocean Springs. That's my central office, so smack in the middle of the Gulf Coast. And then we also have a newer clinic in Gulfport with Singing River Gulfport, which formerly was Garden Park, for familiarity for everybody.
So you get to actually spend some time moving around coastal Mississippi.
Yes. Yeah,
that's cool. So you went to the University of Southern Mississippi. Where did you grow up?
Well, my parents were military, so kind of grew up a little bit of everywhere, but I certainly claim the Gulf Coast as my original home. That's where my parents were. They were born and raised here in Pascagoula, and I followed suit. When I finished college, I followed them back down here.
Well, listen, we talk about this a lot. In fact, I talked about it last week. The number of physicians and others in the medical arena who came through the military and decided to settle here. They're from all over the United States, but their experience at Keesler usually is the thing that sort of introduced them to coastal Mississippi, and they end up falling in love, and the rest is kind of history. So, hey, just kind of give me your elevator talk on how you describe to people what you do. Why don't you do that real quick?
So I have several roles, but we have different types of patients here. Like I was saying, I would say that one of my primary focuses is our surgical weight loss patients. So if a patient is meeting with one of our surgeons to come in for surgical weight loss, I counsel them during their weight loss journey before they have surgery, to make sure that they are set up for success, to get themselves in good behavior changes, good habits, good routines, and have a good understanding of what good nutrition means. And then I, of course, monitor them afterwards, work with them when they come in for follow-up appointments, to make sure that they're doing okay, staying on track, all those good things. So, and of course, that time period before surgery it varies, depends on what patient's insurance may require. And then we do also have cash pay options. So sometimes that might look a little quicker. And also, of course, that depends on what the patient and the surgeon decide. So lots of different moving parts there, but it keeps things interesting. We also offer non-surgical weight loss, which is what is called medical weight management. And of course, that's become really popular in the past 5 years with injectable and oral weight loss medications. So I have the opportunity to meet with patients one-on-one that are going through that process and program. And of course, the patient comes in, they meet with one of our nurse practitioners or physician assistants, and we have these programs at all 3 of our clinics. So I get to meet with them one-on-one. That looks a little different because they're not having surgery, but, teaching them about good, healthful nutrition, healthy lifestyle choices, how that may work with, depending on the medication that they may or may not be on. And sometimes patients aren't on medication at all, and they're getting that good accountability that I think sometimes we all need.
Well, so last week I had a conversation with Dr. Ramon Brown.
Yes.
And we talked about colon health, but one of the things we talked about is that a lot of it's part of Southern culture. I'll just say it in my words, is to enjoy eating and not to be too focused on healthy eating. In fact, a lot of the Southern culture is not healthy eating at all when you get down to it. And I think it's interesting as you think about RFK Jr. and his contribution to helping us think through again the amount of processed food that's out there and how we should really focus on whole foods and all of that. I bet you are constantly having that conversation.
Yes. And I try to make sure that patients, I think sometimes there's so much information out there, and there's been all these fad diets over the years. And I had a patient the other day, she came in, she said, I'm just so confused. I don't know what's what. And so I definitely try to set people back on track. And sometimes they just need a refresher course of, what we're taught in school, for example, in our youth as, okay, we eat our fruits and veggies. And sometimes it's easier said than done. But yes, most definitely.
It's hard. Another thing that Dr. Brown and I talked about is that 51% of Mississippians live in rural areas. And, in some cases, they don't even really have good access to healthy foods. It's just, that's the reality of it. And so you spend some time helping people try to figure out how can they navigate those difficulties and still live a healthy lifestyle. And I mean, don't you find they're more open to these conversations today than they were, say, 5 years ago?
Absolutely. My career as a dietitian, I've seen up, down, all around of various populations. And yes, it can be more challenging for some, but every person that comes to visit with me, they want the help, they want the knowledge. And I try to always make sure that I teach somebody at least one thing. It's sometimes even patients that come in and they're just more, I guess, a little more guarded because sometimes we're all, scared of change or nervous of change. I try to make sure that somebody can find something that they can do. And I ensure that everyone sets themselves realistic goals because no one's going to magically wake up tomorrow and eat and drink everything that they're supposed to. So just setting those realistic goals for people. And I definitely try to, work with other agencies and other organizations. If a patient is needing more specific medical needs or other providers, referring them, as needed to other specialties. I try to always find the best fit for the patient. Absolutely.
So people who are watching on Facebook or YouTube or on SuperTalk TV can see Madison. For those of you listening on the radio or on podcast platform, you can't. But let me tell you what I see. I see someone with a great smile. I see someone who you can tell when she's talking that she has passion for her patients. But you genuinely love what you do, don't you, Madison?
Absolutely. It's interesting. My career has taken me in many journeys, and I was previously with Singing River several years ago as a Morrison Healthcare dietitian. And of course, life changes you and takes you in so many journeys, and it worked out that just less than a year ago this position came open again, and it was just like a knock on the door. And people were messaging me and calling me like, "Hey, I think this opportunity is open again." So yes, it's truly amazing to see the patients that I worked with many years ago that say had the weight loss surgery many years ago, and they have found a new life. They found success, and then our patients that come in that just want how to learn how to eat healthier and control their blood sugar. And I didn't mention that earlier. I can certainly see patients based on referral or consult or self-referral for either general weight loss or healthful nutrition, as well as specific medical nutrition needs. But yes, when I see that light bulb come on for patients, and I can see either long-term success, yes, that's why I wake up every day.
Well, I mean, it seems that what you're in is the hope business. You're about giving people hope and happiness in their lives again. And you can see it. You can see it, and you want them to see it, so they'll pursue it in a determined way. And sometimes it takes the dogged determination to achieve the goal, but that's what you're here for. When we come back on the other side, we'll continue our conversation on this really important and interesting conversation about weight loss with the Singing River Health Talk. We'll see you after this. Welcome back to the Ricky Matthews Show for this really special weekly edition. We'll have it every Wednesday, second half of every Wednesday show, Singing River Health Talk. And today, Madison Ainsworth, who's a registered dietitian nutritionist, is joining us. And as we were discussing, they have a wide range of stuff that they do, coaching patients both in surgical scenarios and both in non-surgical scenarios. And we were just kind of walking through what some of those things are that she's involved with. She travels all over the coast, I might add. And that's pretty cool when you're not just in one place, doesn't it? That's a pretty cool scenario, isn't it?
It is. And I say, when I tell people about the coast, I think that we're kind of, one nice melting pot down here, and every, little town down here and city, I think there's our, own personalities. And so some of the populations, are very a little different because we have so many different dynamics, and it definitely keeps it interesting for me as a clinician because there's so many cultural factors that get involved. What we were talking about earlier about Southern cooking. Well, we have so many wonderful cultural cuisine down here. So of course that's directly involved with when I'm talking with patients. So absolutely keeps things really interesting and fun.
I think the way you said that's super accurate. In fact, I talk about that on the show all the time, that coastal Mississippi is a collection of communities, each with their own very unique sense of place. And together, when you bring them all together, it creates this wonderful region of Mississippi that's incredibly diverse. And that's one of the reasons people like to come here. They flock here from all over the United States to visit here, because they like that small town feeling. And people are proud of their places. We learned after Hurricane Katrina, incidentally, that buildings don't make a community, the people make the community. And we have such a great understanding of that. So one of the things I was interested in seeing, that the support group aspect of what you guys do is really important, isn't it?
Yes, most definitely. And we offer in-person and virtual opportunities. So we have a Facebook group. It's under Singing River Weight Loss Clinic. And for our surgical and non-surgical patients, anybody can join that's interested in becoming our patient. So whether they've had surgery, they're in the process or in that journey, or they're going through medical weight loss management, they can come, and we try to post nutrition and health information, of course, on our social media. And then we have monthly meetings. I try to keep it engaging. We have guest speakers. Like last month, we had our HealthPlex fitness director come in and speak to our patients about fitness tips. This past month, we had Dr. Gary Bachman, that many of y'all may be familiar with. He is a retired Mississippi State University Extension horticulturist, and he spoke to us about growing our own produce. So that was exciting to have that aspect. So we just like to engage our patients, and I think that having that support group is super important. for people to feel like they almost have a home. Because some patients, their journey is very private. Some people are loud and proud about it. They're putting it everywhere. Like, I had weight loss surgery, or I'm having surgery. But, that looks very different for everybody. So I think it's nice. I like to offer that safe space and that fun space for patients to have to interact with each other. And it's amazing to see that so many of them have maintained relationships, friendships, and whatnot. It's so wonderful. And then they can have that aha moment together, like, oh, and share their successes and their tips of what helped them. So and then we also do offer kind of more physical activity opportunities. This past Friday, we actually did a walk on the Biloxi Ocean Springs Bridge. It was a little breezy, but we did half of it because it was just too windy. But we had a really great turnout for that. So I think people really I certainly enjoy the opportunity to see people come out and enjoy some physical engagement together and just having a nice time for fellowship.
So Madison, when a patient comes there and has a goal of losing weight, and there's so many different approaches they can take. They can decide to do it without drugs and focus on nutrition and physical activity. They can have surgery, or they can take a drug like Ozempic or something like that. Are you part of the evaluation process as they think through what their options are?
No, sir, not really. So there's, as far as different pathways, some patients come in for an evaluation of what we call a bariatric consult. That's where they meet with one of our physician assistants or nurse practitioners, and one of those ladies will discuss with them, different options based on their medical criteria or their insurance. There's so many, like I said, moving parts. And then if they're able to meet with the surgeon, if their insurance covers it, then, that's when the surgeon, would discuss with them. So
yeah, well, that's good. And then once the plan is developed, then you guys get involved. But yes, seems like you're pretty much staying on your toes these days with plenty to do and plenty of people's lives to change. And I tell you, it's been a pleasure to meet you. I really appreciate you joining me today.
Absolutely. Well, I appreciate y'all's time so much. It's been great talking with y'all.
It has been good talking with you. This has been Singing River Health Talk, and I really enjoyed our conversation today with Madison Ainsworth. And we'll do it again next week, next Wednesday, second half of the show. So until then, we'll see you tomorrow.